Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Wbhrb Staff Nurse Grade 2 2025 CBT based question answer Part 23. Let's start. The first question. The most critical action a nurse can take to prevent the spread of Clostridium difficile C. diff is option A. Use alcohol based hand sanitizer. Option B. Wear sterile gloves. Option C. Wash hands with soap and water. Option D. Disinfect the room daily. The correct option is option C. Wash hands with soap and water. CD4 count is critical in the management of which condition? Option A. Diabetes mellitus. Option B. HIV AIDS. Option C. Tuberculosis. Option D. Multiple sclerosis. The correct option is option B. HIV AIDS. The major buffer in human blood is option A. Hemoglobin. Option B. Phosphate. Option C. Bicarbonate. Option D. Ammonia. The correct option is option C. Bicarbonate. Non-nutritious substances which are added intentionally to food to improve appearance, flavor or storage properties are called option A. Canning. Option B. Food additives. Option C. Steaming. Option D. Food fortification. The correct option is option B. Food additive. For NG-tube feeding, correct patient position is option A. Supine. Option B. Left lateral. Option C. Prone. Option D. Fallers 30 to 45 degree. The correct option is option D. Fallers 30 to 45 degree. Which fluid is preferred in burns during first 24 hours? Option A. 5% dextrose. Option B. RL. Option C. NS. Option D. D5NS. The correct option is option B. RL. In head injury, mannitol works by option A. Diuresis. Option B. Reducing CSF production. Option C. Decreasing blood viscosity. Option D. Osmotic gradient. The correct option is option D. Osmotic gradient. Ideal presentation for normal vaginal delivery. Option A. Cephalic vertex. Option B. Breech. Option C. Transverse. Option D. Face. The correct option is option A. Cephalic vertex. In hospital waste segregation, yellow bag is used for option A. Plastic waste. Option B. Sharp waste. Option C. Human anatomical waste. Option D. Glass waste. The correct option is option C. Human anatomical waste. A patient on morphine IV develops pinpoint pupils and respiratory depression. What is the antidote? Option A. Flumazenil. Option B. Naloxone. Option C. Atropine. Option D. Protamine sulfate. The correct option is option B. Naloxone. Normal CSF glucose. Option A. 10 to 20 mg per dl. Option B. 25 to 40 mg per dl. Option C. 45 to 80 mg per dl. Option D. 100 to 120 mg per dl. The correct option is option C. 45 to 80 mg per dl. When did the Mental Health Bill become the Mental Health Act? Option A. 1990. Option B. 1987. Option C. 1912. Option D. 1985. The correct option is option B. 1987. Vaccination is an example of option A. Artificial passive immunity. Option B. Herd immunity. Option C. Natural passive immunity. Option D. Artificial active immunity. The correct option is option D. Artificial active immunity. The most common cause of blindness in India is option A. Cataract. Option B. Trachoma. Option C. Refractive errors. Option D. Vitamin deficiency. The correct option is option A. Cataract. Which vaccine is contraindicated in pregnancy? Option A. Rubella. Option B. Tetanus. option C, diphtheria, option D, hepatitis B. The correct option is option A, rubella. Which one of the following nursing measures would be most appropriate in the care of the patient who has acute epistaxis? Option A, tilt the patient's head back. Option B, place the patient's head between his legs. Option C, pinch the nose and have the patient lean forward. Option D, place warm compression on the patient's nasal bridge. The correct option is option C, pinch the nose and have the patient lean forward. Which of the following actions would a nurse take first when caring for a patient experiencing a cardiac arrest? Option A, initiate cardiac monitoring. Option B, provide intravenous access. Option C, establish an open airway. Option D, obtain a pulse oximetry reading. The correct option is option C, establish an open airway. A 55-year-old male patient who is diagnosed with an involving myocardial infarction (MI) insists on going home. The nurse encourages the patient to be admitted because the greatest risk within the first 24 hours of sustaining an MI is option A, heart failure, option B, sudden death, option C, pulmonary embolism, option D, ventricular aneurysm. The correct option is option B, sudden death. Which one of the following enzymes is found or secreted in the saliva? Option A, renin, option B, ptyalin, option C, tannin, option D, resin. The correct option is option B, ptyalin. The ideal angle of insertion of a needle for administering an intradermal injection is option A, 15 degrees, option B, 30 degrees, option C, 45 degrees, option D, 60 degrees. The correct option is option A, 15 degrees. Thank you for watching. Please like and subscribe.